Dr. Chandramohan, do you want to say something to get us started?
Yes, sir. So, dear colleagues, uh, today we are talking about the statistics, how to collect the data by Dr. Denis Xavier, sir. Um, good evening, one and all. So, let us start the program, please. Okay, sir. Over to you, sir.
Yes, I'll show my cover slide and then Dr. would say a few words and then we could get started. Yeah. So we're going to do basics of biostatistics for doctors and then we do parametric tests, that is t-test, ANOVA and ANCOVA. And then Dr. Apul, for your opening remarks, please.
Good evening, everyone, and thank you, ASU, for this opportunity and to be part of this research methodology webinar series. So, we had a very fruitful last few weeks where we discussed the research designs, the cross-sectional study, how to do a cohort study, what is a randomized control trials, and how do we plan. So, we went into the basics. Dr. Xavier explained extremely basic things about these research study designs, when to choose which type of a study, which type of a study will give what type of results, and all those things we have discussed. So today we will be changing gears. Now we move on to a little higher level, I think. So these are biostatistics. As basically surgeons, we are a bit scared of biostatistics because this is the part which we left long ago when we joined biology. We left maths and then we never looked back. So we are always a bit scared when someone tells us about formulas and things like that. So, but for doing research, for writing papers, to understand papers, I think we need to know something about biostatistics. So I hope these sessions today and tomorrow will be very, very useful. I think we'll cover the basics and then build up on those basics. So over to you, Dr. Xavier.
Thank you very much, Dr. Apul. Very pertinent points. Um, we do two things today. One is an introduction to biostatistics, and then we do parametric tests, something that we see all the time in our journals. And when we reach that one section which says statistical methods, we skip it. He said, they use standardized methods for statistics and very high quality statistics, and then quickly go to some results, and then we want to know what the conclusion is. That is the part we want to rush through. And my goal for all of you is to become friends with these apparently strange creatures who, as Dr. Apul said, we left many years ago, and we don't want to see them, or we see them approaching us. We cross the road and go to the other platform, other footpath, wherever we find footpaths in India. It's difficult to find. So my goal for y'all is, when you see this apparently strange people walking across, walking ahead of you, or sorry, walking towards you, you will at least stand and smile at them and say hello to them. So, in other words, not to be intimidated or hassled, like I was as well. I remember 1.5 years after I collected my data, even my head of the department said, there is nobody good enough. This is 1994. Nobody in St. John's can teach you statistics. You go to NIMHANS. So I went to another institution. I stood outside the gentleman's door for so long for him to come after rounds, and then I spent 3 minutes with him, and then he said, "Okay, go ahead." So that is how I did my first statistics as a PG student. So with that, let me ask all of you one question. What three words come to your mind? Three words come to your mind when you think of biostatistics. When you think of, so please put this on the chat box, but don't hit enter. When you think of biostatistics, what three words come to your mind? So just ordinary English words. Put it onto the chat box, but don't hit enter. Just wait for some time. So I'm going to stop sharing now for a few seconds and then wait for you to put it on the chat box. Come, please, everybody. Start entering. Every Dr. Apul, you as well. You're editor of the journal. But what comes to your mind when you think of the word biostatistics? Yeah, please Okay, everybody is put it on the put in your chat box. Okay, now hit enter. 3 words. 3 words. After you type out 3 words, hit enter now, please. Please, everybody hit enter. Okay. Satya is very interesting. Very, very difficult. Tanmay, good. Tanmay, nice to have you here. Community medicine, significant and p-value. Okay. Confidence intervals. Okay. Anything else? All right. So let me. All of you are very academic. So what I have got in other courses is scared, dislike, let somebody else do it. Not for me, not for doctors. Irritating, mathematics, complicated, those are the things. So the first thing that I want to tell all of you is biostatistics has mathematics in the back end, but you don't have to deal with mathematics. So all you need is, what do you say, 6th or 8th standard, not even 8th standard mathematics. You need just some square root and some division, addition, multiplication. That's all. And even that you don't have to do. Okay, so let's go back to our slides. Okay, and from here, let's look at a few other questions. Think this over. What does this mean? Okay, you want to go from point A to point B. Like right now, Dr. Ginnell is waiting in point B. That is his son's place. Now, where he has to pick him up. And from there, he has to drive back home. That is point A. You want to get from point A to point B. What do you want to do? You want to sit in the back seat and be driven in a car? Or do you want to drive the car? Or the third option, interesting. Third option is you have a car in front of you. You know driving, right? You want to know everything about the car. So first you said, open the bonnet. I want to check the engine, right? I want to know everything about the car. Okay, I want to know the brake horsepower. I want to know what the torque is, what are the cylinder configuration, what are the curb weight, what are the wheelbase. And now these days with cars, there are so many electronics that have come in. And if something goes wrong, you have to throw it away and then fix another one. Those days we used to make little repairs here and there, adjust some wires, and then we managed. But these days it's... So do you want to know every detail about the car? You want to open it, go under the car and come out all dirty? Do you want to do that? Or do you want to know the basics of driving the car? Sit down, here is your steering, and let's assume it's a stick shift car. So this is the accelerator, the brake, the clutch, and then this is a 5-geared car or a 6-geared car, right? This is reverse, this is the mirror setup, all that. Okay, go ahead now, right? What would we prefer, right? It's nice to be driven in a car, okay? And many people do this. They collect data, and there are companies these days. Probably some of you may be using them. You send your data to them. They will do the analysis. They will create tables. They'll create graphs. They'll write some paragraphs for you, and then they'll give it to you. Right? So you don't know what the hell happened with that data, but some magic happened, and you have something that you want to put in your thesis, or you want to put in your paper and submit to a journal. So you send some data in an Excel sheet or wherever, and then people did this for you. I would not recommend this. I would not recommend this, and I would also not recommend this, although some doctors are very, very good at biostatistics. Okay, and they do their own statistics. They're able to do their multivariate analysis. For my initial projects, I did a fair amount of statistics, but now I employ people to do that through my research projects. And then, of course, we discuss with them, what is it? What are the variables you want to use in the multivariate analysis? And then how should this be? How should that be? In fact, I have a small little module which I will do for you on how to work with a statistician. Very, very important aspect, which I will share with you. So I would definitely not recommend this. As researchers, we need to know what is happening, right? And not be completely blind. And this is not needed. But I would highly recommend learning how to drive the car. That means knowing what is happening. Knowing what is happening, you don't have to do all of that. Okay, so with that, let's look at what are the objectives and methods of this session. Again, as I gave you in the modules on study designs, and as Dr. Apul said in his opening remarks, we got clarity on concepts, right? Fundamental concepts in biostatistics, the basics that any researcher should know. What methodology we'll follow? I'll give you these concepts with examples, and one of the commonest software that people use or package that people use is SPSS. Um, I will tell you later on more about it. SPSS is expensive. It can, I mean, of course, you have a student license single user version, which still costs several tens of thousands, but institutional version costs several lakhs of rupees. You don't have one particular price. They give you all kinds. So for our institution, we had bought, we have the license, and then our group, research group, has paid some extra money so that we can have so many licenses to use. So that is SPSS. Now something quite similar has come, which is free to use, called Jamovi, 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 right? And many of my students are using it, and it's quite nice. Okay, so I'll give you examples from SPSS and how to interpret it. Minimum formulae and notations, a little bit, and I'll tell you, don't bother about it. Sometimes I'll show you a formula, and then I'll show you what is in the numerator and what is the denominator. That part, and then of course, for any given statistical test, we can have more than one formula. I'll give you the simple formulas, but you don't have to remember it. Okay, we'll keep it as interactive as possible, and whenever I ask you, please enter in the chat box, so it also makes the discussions lively. All of us know this formula, right? IDK formula, which is, I don't know, it's quite all right. All right, and it's good to know that we don't know something. I'll say that again. It's good to know that we don't know something. Awareness of our ignorance is the start of knowledge. Okay. So questions you can put in the chat box in the end, or we will discuss as we go along. Okay. So I will answer the question, or I'll defer the question and say, no, it's coming next time, or I will say, I don't know. By the way, I mean, I've done a course in statistics, but I wouldn't call myself a statistician. Statisticians have deep knowledge, the basis. I don't have the depth of knowledge. Okay, so I will comfortably say I don't know. But what I have is clarity on concepts that doctors should know. Researchers, clinician researchers should know. That part I will share with you, as I've been sharing the last several weeks. Okay, so here are a few questions for us to think over. We don't have time to go through answers, but here are the questions. What is descriptive and what is inferential statistics? Sometimes we hear this. What are the difference between variable, parameter, and data? Oh, we've heard these words: variables, parameters, data. What is the difference between them, right? Then we will look at importance of testing for normality of your data. Yeah. Is normality assumption fulfilled? They'll ask you. So what is the meaning of normality and how do we test for normality? Right? That is the next one. Data transformation. That's interesting. It's not data manipulation, data transformation. Two very, very different things. Right? And what is data transformation, and why is data transformation done? And a few methods of data transformation. What is dispersion? What is dispersion? What is a p-value? What is confidence interval? We keep getting this all the time, right? These are basics, fundamentals in statistics, right? Right? What is confidence level? What is confidence interval? And what is confidence level? Two different things, right? And finally, magnitude and direction of difference between groups. We keep looking at that, right? Okay. So with that, these are the contents of our session today. Types of data, descriptive statistics, inferential statistics. I will not be doing presenting data today. We don't have time for that. We'll do dispersion. We'll do tests of normality. We'll do data transformation. We look at p-values, confidence interval, and confidence level. Time permitting, we'll go to parametric tests. I think we can do at least t-tests, the unpaired and the paired t-test. We may have difficulty with time to do ANOVA, but when we are doing analysis of variance, we have one-way, repeat measure, factorial, MANOVA, and ANCOVA. So this one is a little question mark. It depends on the pace with which we go through the previous ones. Okay, but otherwise, don't worry. We'll make a note of where we stopped, and then we can do that tomorrow. So we have a session tomorrow, right? Okay. So let's take these definitions first. What is descriptive statistics? And this is taken from Douglas Altman. And some of you may know Bland Altman plots. You may remember that. So these are the two statisticians from the UK. They are living legends of statistics, and then they've written several textbooks as well. Okay, what are descriptive statistics? First, it is how we present, organize, and summarize our data, right? What is inferential statistics, therefore? So once we have this data, when we ask the question, so what? What does the data mean? So what? That is inferential statistics. So this allows us to generalize from the sample data to a larger group of subjects or to the population, right? Or to the population. That's what it means. Okay. So let's take a simple diagram here. So this is the population that we're interested in. Let us say for all of you all urologists, these are all people with prostate cancer, let us say. Okay. Everybody with prostate cancer, right? But will we be able to do any study on everybody with prostate cancer? Not possible. Number one, not possible. Number two, not needed. Not possible. I mean, it's not impossible. It's not needed to study everybody. Therefore, we always study a sample of the population. And when we did cross-sectional study, I told you about sampling frame and sampling methods. What is a sampling frame and how do you take a sample from the population? I told you. So that's what it is. So we have the population, right? And then we construct a hypothesis. We construct the hypothesis. Then this white little rectangle here is the sample. We take that sample and we describe that sample. So many males. This is the proportion of males. Of course, if it is prostate cancer, there's no females. Okay. Let's say if it's bladder cancer, you'll say males and females, right? And then age, mean and standard deviation, socioeconomic status, and all of that. So we just describe that population. That is descriptive statistics. Next, what we do is from this sample that we have, we perform certain tests on that sample. We'll have, based on the hypothesis we have, based on the hypothesis, we may say, people who present with stage 3 prostate cancer versus people who present with stage 1, or PSA levels at whatever stage, whatever PSA levels. One group with a lower PSA level, another group with a higher PSA level. We want to compare the two. We compare the two. That is the meaning of conducting tests on the sample. We conduct tests on the sample and then we make conclusions based on the sample. Conclusion is based on that sample. Next, this is the important part. These conclusions we now apply to the population, or we generalize to the population. This generalization is called inferential statistics. The English meaning of the word infer means make a conclusion, or we have some understanding based on what we have found. So this is inferential statistics. All right, so let me go backwards once again very quickly. So we have the population, we construct the hypothesis, we take a sample, and we describe the sample. Table 1 of many studies are descriptive statistics. Table 1 of most studies in a journal are descriptive statistics. Then we do tests on the sample, we make conclusions based on the sample, and then when we generalize to the population, the test that we do to generalize to the population is inferential statistics. Now, to generalize to the population, we have certain rules, or we have certain assumptions. So I'm sure all of you are familiar with p-values. We say, okay, if this works 95% of the time, that's fine. Okay, 5% I'll allow to chance. That means I'm going to test my inferential statistics will be tested at the level of 95%, or my p-value, the probability that this is due to chance, must be less than 5%. That is what the p-value is. We're going to talk a little bit more about the p-value as well. Okay. So any numbers you saw so far? No numbers, no tests, nothing, only concepts. Okay, continuing on. Let's just sort out some of these definitions that keep coming. What is variable? Variable is anything that varies from individual to individual. Quantities that vary from individual to individual. Blood pressure, height, weight, all of these vary, right? Again, for urology, bladder volume, or residual urine, or PSA levels, whatever it is. This varies from people to. That is a variable. What is a parameter, therefore? Parameter describes the entire sample of the population. That is a technical meaning. What does that mean? And we use a statistic to explain it. What is that? In a normal distribution, the parameter is mean and standard deviation. So mean PSA is a parameter. Okay. PSA of one particular patient is a variable. Another patient is a variable. But the mean in that whole sample to describe that population is mean and standard deviation in a normal distribution. In a non-normal distribution, it is median and interquartile range. Sensitivity and specificity out of screening test, slope of a graph, these are all parameters. What is data, therefore? Data is something that is systematically recorded, either as numbers or labels. Right, the word data is plural and the singular is actually datum. We rarely use the word datum. Anyway, so let's move on now. Now I'm going to tell you types of data. I'm sure all of you have heard this multiple times, and at the end of it, you are still confused. And people have explained it and whatever. So I'm just going to present this only on one slide. And I will not guarantee you that you will completely understand it and not be confused at the end of it. You need time by yourself. Just look at it. Any standard paper or a textbook will give you descriptions to this along with examples, but I'll make this very brief today. So categoric data, what type of data? Quantitative data is numbers, how many or how much. Categoric data, we have nominal data and ordinal data. Under nominal data, we have binary and we have non-binary. What is binary? Okay, let's come back to binary later. In quantitative data or numeric data, it is continuous or discrete, and then we have interval or ratio scales. Interval or ratio scales. Right? So there are several. Okay, binary means they can have only two options, whether the patient has the condition or not, patient is alive or not, right? So like that. And non-binary can be more than that. So I'm just going to stop here rather than giving you examples and explaining, because at the end of it, you will get, why is this continuous and why that is ratio? What are the difference? There are, and I would urge you, this is pretty straightforward, but only thing, it takes a little while for us to get it. Instead of spending time on which is straightforward and theoretical, right? I will go on to other concepts, which is more useful for us at the moment. Okay. Okay. What is normal distribution? So all of us have seen this multiple times, right? And this is called the bell curve or the Gaussian distribution. Okay. Right. What do we see here now? The first, it is symmetric and has only a single peak. There's no double peak. It is symmetric. That means this side and this side are exactly the same. It has a single peak. Next, mean, mode, median, and mode are right here, right in the middle. Mean, median, and mode is right here. Okay. Oops, I got it a little bit off. Okay. Well, whatever data is this. So for now, we have put it as 0, just to show where the middle is. Then the important thing is almost all of the data, 99.7% of the data is within 3 standard deviations. So in other words, 1.5% of the data here, 1.5% of the data are here. That's all. Almost all of the data are within 3 standard deviations here. Okay. So this is a normal distribution. Mean, median, and mode are the same. There is no skew. This is otherwise called a perfectly symmetrical distribution. Now, there can be variations to this. Oh, by the way, let's go back to this. In nature, if you collect data, if you collect it randomly without any bias and a large enough number, right, you will get normal distribution. Large enough, collected randomly without any bias or without any other factors kept in mind, you will get normal distribution. Almost all data in nature are normally distributed. There are a few, like serum ferritin for some reason is not normally distributed, is what people say. Okay, so let's go back to different types or variations from the normal distribution. So this is symmetrical, no skew. Now this one is positively skewed, right? It goes towards the right. So we call, so there's nothing positive or negative about it. It's just called positively skewed, where the median is pushed to another side. So mean, median, and mode become different when there is a skewed data. And this is a negatively skewed data, right? So why do we need to know this? Experts say we need to understand your data before you analyze them. So put a scatter plot of your data and then look at it to see how they are distributed. That is visually. Now, can I test for normality? Yes, for sure, we can test for normality. So normal distribution is a prerequisite for many statistical tests. If you're doing your BSc in statistics or a MSc in statistics, you need to sit and mug up. Or you need not just mug up, you need to know the assumptions for many tests. Like, for example, the t-test has 7 assumptions. So we need to know that. I'll tell you a few of them. You try and understand it. Don't have to remember it. Okay. So normal distribution is a prerequisite for many statistical tests. Now, if they're not normally distributed, what do? There are strategies for that. So which I'm going to share with you just now. So therefore, we need to know what is normally distributed or not normally distributed. First, visual inspection. How do you know? One is visual inspection. I just showed you, a plot or a graph you can do, right? And then you can also do statistical tests. There are many tests, and the sensitivity of the test depends on the sample size and sometimes the type of data as well, right? So graphically, you have what is called the QQ plot. It's called the quantile plot. It's a scatter plot created by plotting 2 sets of quantiles. Okay, you have your sample, and on the next side, you have a theoretical QQ plot. And you look at both of them visually and say, okay, this is all right. Visually, I say my data is normally distributed, and we can go ahead. Formal statistical test. There's a little bit of a mouthful. It is Kolmogorov-Smirnov's test. And then we have the Shapiro-Wilks test. These are 2 commonest tests done. And you will see this in your journal articles. Okay, people will write, our data were tested for normality using the Kolmogorov-Smirnov test, and this is what we found. And since our data are normally distributed, we did this. That is how the first part of your statistical analysis section usually should be written. Now, the Shapiro-Wilks test is for smaller sample sizes, a few hundreds up to maybe 1,000 or 2,000. Smaller sample sizes, we can do the Shapiro-Wilks test, right? If in this test, I'm not showing you this test for now, if in this test the p-value comes more than 5, it means that the data are normally distributed, and then you can go ahead and do your appropriate tests which fulfills the assumptions of normality. Okay, data transformation. So the first thing to tell you, this is not data manipulation. So what is it then? Can one of you, while I take a sip of water, can one of you unmute and tell us your thoughts on what data transformation is and why we do it? Let me trouble Tanmay. Let me see if he remembers the last, I don't know, last year or year before last you did, Tanmay. We can't hear you. You're on mute, Tanmay.
I have the notebook open in front of me, so there's no point.
Okay, go ahead. Go ahead. So just to impress everybody else, tell us what data transformation is.
So it's the application of a mathematical function to each data point. So basically, each data point is replaced by a transformed value for which it is easier to interpret, makes it easier to interpret and makes it better distributed at times.
Okay, very good. अभी थोड़ा इंग्लिश में बताइए. वो तो स्टैटिस्टिक्स का लैंग्वेज था, अभी थोड़ा इंग्लिश में बताइए आप. What does it mean? So in other words, Tanmay, what does it mean? Well, what you said, your definition is right.
So you are basically, if there is a set of data that is maybe not homogeneous or not represented in a visually, say, continuous manner, it can actually make it more homogeneous or more interpretable using certain formulae, something like that.
Okay, you're somewhere close, but there are a few things that are off. Like sometimes when you play music, no, somebody is playing off. The guitar is not tuned somewhere. Okay, it doesn't matter, but you're somewhere there. You're somewhere there. But what is it and why do we do it? And why should you, as a urologist? I mean, you're a surgeon. You cut the you cure people that way. Why do you need to know about data transformation?
So firstly, to make it simpler to understand, that would be one assumption I'd make about data transformation. Other thing I would say is um, like to make the data maybe normally distributed so that certain statistical tests could be applied to it.
Right, absolutely. The second part is the clincher, Tanmay. So when you want to do certain tests for which normality assumption should be fulfilled, then you do data transformation. Let me ask my other good friend Satya, what are the difference? You would have heard of data manipulation. Everybody has heard of data manipulation. So what is data manipulation? Why should Tanmay take all the trouble? And then there are some fancy things that you have to do, mathematical function and all, some jazz he told us. Why do all that? And in, I don't know if anybody here knows Kannada. In Kannada, we say ಸ್ವಲ್ಪ adjust ಮಾಡ್ಕೊಳ್ಳಿ. Make little adjustments and make the data look like how you want it. That is data manipulation. So what is manipulation versus transformation, Satya?
So that we get the p-values.
Right, we all want p-values. Okay, good. All right. Okay. So let's go through this. Thank you, gentlemen, for your interaction. You gave me a little break as well, and I took a sip of water. Okay. What is data transformation? So exactly as Tanmay said, he wrote good notes. It's application of a mathematical formula to each data point. To each data point. That is the important thing. Okay. And each, I mean, if you want to look at it, each data point, which is ZI, whatever, is replaced by a transformed value. So, okay. So this F is the function that you apply to each of those data points. You have 5,000 data points. Every 5,000 data points are transformed. Why to do this? Why all this trouble now? Okay. But before that, one other thing is, you'll sound very intelligent when you talk to the statistician now. Statistician will look at you like this. So you can ask, how are my data now? Are they normally distributed? Not normally distributed. So are you planning some data transformation? So what strategy are you going to follow? A statistician will say, oh, wow, I thought you were a surgeon, but you know statistics. So you'll get floored. Or you can floor a statistician, especially if the statistician is a little good looking. You can be a little more you can transform that person's opinion. Anyway, okay, so there is a young statistician also in our group right now. Okay, why data transformation? Not only to impress statisticians, but why do we do that? Okay, for your graph to appear a little better. Do you all remember some time back, you log transform the data, you'll get a smoother curve. Has anybody told you that? Where you would have heard it. Okay, right. So to change the distribution to meet statistical assumptions for tests, you want to do a parametric test, okay? But your data are not normally distributed. It does not fulfill your criteria for doing a parametric test, and you want to do a parametric test. Keep in mind, parametric tests are always more powerful. All right, so you want to do that, so you transform your data. And then also for easier interpretation. Remember, if you transform the data this way to that way, you can back transform it as well. And in the last but one section on statistics, I'll be doing a very important multivariate analysis for you, which is called logistic regression. right? A lot of your studies use logistic regression. In that, you will see how we log transform the data and then back transform it as well. We'll see that. Okay, so this is data transformation. So this is where you can impress a statistician and say common methods. So are you doing log transformation, or did you want to try square root transformation? Oh, which is better than that? I'm not very sure. You can, or here multiplicative, inversal, reciprocal transformation. There's one more which I've not mentioned. It's called arcsine, ARCSINE, arcsine transformation as well. Honestly, if you ask me which one to use where, I don't know. Okay, right? So that is where you need a deeper understanding which statisticians have. But definitely, if you ask your statistician, are you planning to transform data, and what strategy or what tests are you, or what method are you going to follow? Not strategy. What method are you going to follow? That person is going to be really impressed. Okay, let's go to dispersion now. Now that we understood data and transformation of data, let's go to now understanding the data a little bit. Now, dispersion is a key concept in statistical thinking. Okay. Now, the central tendency, I mean, I'm sure all of you are familiar with mean, median, mode. I'm not going to go through those basics. It will only irritate you people. So, mean, median, mode is the central tendency. What is the central tendency? Central tendency, mean alone does not describe the data. We need to know more about the data. The basic question is, how much do the scores or the data deviate around the measure of central tendency? How much do the scores deviate around the measure of central tendency? Now look at this. Coffee consumption of two groups. Okay, so we have, so group 1, mean is 7. Okay, how many data points? 1, 2, 3, 4, 5, 6, 7, 8 data points. Mean is 7. How about this? This also same. Mean is same. Any difference between the two groups? Satya, what do you think? What's the difference between group 1 and group 2?
Yes, sir.
Let us assume this is 1 and this is 2.
So 2 is having more variation, like 1 and 1 is also there, 13 is also there.
So what? I mean, the mean is the same, no? Is that okay? I want mean. So both groups are the same.
Yes, sir.
Are both groups the same? The
No, sir,
mean
there is
of
a
both groups are
deviation.
the
There
same.
is a deviation.
Okay, I'll say this again. The mean of both groups are the same, but when I look at the data, I gave you only 8. What if you had 800? Difficult for you to make out. No, what if you had 8,000? This side, 8,000, that side. So that's why dispersion is a key concept, and we need to understand that. Okay, so this is group 1 and group 2. Mean is the same. Look at this. Mean of group 1 and group 2 is the same. But see this. See this. See this. Right? So it is different. And see this. It is different. Okay. So measures of dispersion is for us to look at how closely data cluster around a measure of central tendency. The more bunched up around the central tendency, we are better able to make more accurate predictions or understand that group a little better. So the measures are of central tendency are range, interquartile range, variance, and standard deviation. Very quickly, we'll go through all of this. Okay, so these are the measures of central tendency, and I'm sure all of you are most familiar with standard deviation. We see that all the time, isn't it? But we'll quickly look at range, IQR, and variance. Range. Now, what we learned in school, we still have in our head. Range is 2 numbers. Range is 2 numbers, smallest to the highest, correct? But that's not what range is. Range is not 2 numbers from X to Y. Range is the difference between the highest and the lowest value. What we learned in school was this, which is not right. Okay. So range is a single number, highest minus the lowest value. It kind of describes how spread out the data are. Example, duration of stay in a hospital of a particular patient. So what is the range here? One second, please. Let me mute somebody's line. Who's Abik is unmuted. Ramaprasad is also unmuted and he's singing bhajans. Okay, so we will, I muted them. Okay, so what is the range for this one? 15 minus 1 is 14 days. All right. But what are the limitation of range? Look at this now. Suppose to the same advantage is very easy to calculate, right? Disadvantage, you look at this. If one patient stayed for 24 days, to this 15, you added 24. Now this range from 14 almost doubles to 23. One patient can draw the range. That is why we hardly use range. You don't see range in your journals, isn't it? So, but quickly, what is range? And advantage, disadvantage, I told you. So we rarely use this. So learning number one is range is a single number, highest to a lowest. But one data point can drag it pretty far. Okay, so we look at now interquartile range or mid spread, and this is something that we use in our journals and in our presentation. So let's look at it. Okay, here are the same data. Remember, patient stayed for 1 day, 15 days, and we also added 24 days. Now, what is our mean? Mean is right in the middle, 7. All right. Now we divide the data into 4 parts. 4 parts is quartile. 3 parts is tertile. 5 parts is quintile. All right. So now we divide the data into 4 equal parts. 25%, 25%, 25, 25%. Okay. Right in the middle. Now, what do we do? So we look at IQR. IQR is between the upper and the lower quartile. This is the upper quartile here, and this is the lower quartile. So it comprises the middle 50% of the data. It comprises the middle 50%. It doesn't, get skewed by or doesn't vary much by extraneous values. Less affected by extreme scores. So in the 2 examples, range is now 14 and 23 days. What is IQR? IQR is simple. Interquartile range is the same. It is 5 and 12. It doesn't change. This can be 240. It doesn't change. All right. So IQR is pretty stable and we use that. Okay. So this is 12 and this is 5 and this is your median. So how we write it? We write 7 and we put IQR 5, 12. That's how we write IQR. Let's go to something that we use very commonly, variance and standard deviation. Variance is simple formula is S squared is the sum of x bar minus x, and I'll tell you shortly what it is, divided by n. Let's look at the numbers now. Okay, and what does it mean? It's a measure of the average deviation of the individual values. Standard deviation. So first we look at variance. Standard deviation is the square root of the variance. We'll shortly calculate this quickly and I'll show it to you. Okay. So this is standard. So standard deviation is square root of the variance. What are the variance? I'm going to describe the variance to you. This is the very simple formula. Okay. So now the more important thing for us, how do we interpret standard deviation? Okay. Closer the numbers cluster around the mean, standard deviation will be smaller. It's a very homogeneous population. Standard deviation will be smaller. And standard deviation is very important for so many statistical tests. Okay. Don't worry about, if you're doing MSc statistics, you need to know the difference between S and the sigma and variance and all. I'll skip that. Don't worry. Okay. Now, standard error is something else as well. Standard error is standard deviation divided by the square root of your sample size. And we need to understand both. Give me 1 second. One slide has gone missing. 1 second. Hold on, please. I'll just stop sharing. I'm missing one slide here. Right. Okay, I got it. Okay, it's here. Let's go back. The sequence of the slide changed a little bit, but that's quite all right. All right. So first I'll give you the definition, then I'll show you how to calculate it. So standard error, again, we use that quite often. Standard error is standard deviation divided by the square root of the sample size. Now, why do we need to know this? And we will quickly understand standard deviation, because standard deviation is something that we use quite often, and it's needed for many statistical tests. Okay, standard deviation versus standard error, first we'll clarify. Standard deviation describes the variability within a single sample, and we use it to describe the sample. We give mean and standard deviation. On the other hand, standard error describes the variability across population samples. That means, you take a large population, you take multiple samples from there. The variability between those samples are important, and standard error is needed for some calculations. Okay, so I'll skip the second part, and then standard error is needed now for hypothesis testing. Whenever we do our inferential statistics, we need standard error because we're going to apply it to the population. Remember, I told you why we do hypothesis testing. Whatever we found in our sample, we want to now apply it to the population. Right? For that, we need standard error. So now let's look at how to quickly calculate the standard deviation. Okay, now these are data of tablets taken by 10 patients with diabetes in a month. Okay, this patient this is once a day, took all 30 days, all right, and oops, sorry, and this patient missed 10 days. Oops, sorry, I don't know why I keep jumping. This patient took 45, right? This patient maybe was supposed to take 2 tablets in a day or 3 tablets in a day, but whatever. Okay, so like this, they took multiple tablets, and we add this up, it is 525 totally. Okay, now what do we have here? Now we need to now look at the mean. We need to look at the mean. Let's 1 second, let us put this as well. So the mean is 52.5. How do we calculate that? 525 divided by 10 is 52.5. Now I take this 52.5 and minus it from, or we look at the difference. We look at the difference between the total overall mean from each of the data points. So 52.5 minus 30 gives me 22.5. 52.5 minus 20 gives 32.5, so on and so forth. 52.5 minus 110 gives us a positive value here. So what we do is, so x is the actual number, x bar is the mean. So raw deviation means x minus x bar. So what we do, then we take the absolute deviation. We just ignore the signs. Then what we do is we square it. We square each of this. So 22.5 whole squared is 506, right? And then we total this now. We total this. So variation or variance, I'm sorry, S squared variance is the sum of x minus x bar whole squared. X minus x bar whole squared sum is this. We totaled it, divided by n, which is 10, which gives us 2036.1. That is our variance. Now, next one is very simple. Standard deviation is square root of the variance, and it is 45.1. Okay, as simple as that. So now, how far is 45.1 to the mean? Quite close, right? It's quite close. So these data are in our mind. In our mind, it is reasonably well distributed. It's not too bad. It's not too bad. Okay. Now, rule of thumb. The standard deviation should be round about 1/3 of the mean. So if the standard deviation here was somewhere around 20s, it is normally distributed, but it is much higher right now. It is much higher right now. Why? Can you see now? The smallest sample is 15 and the highest sample is 165. Now it is not so normally distributed. Again, these are small numbers. Therefore, in my mind itself, I can say these data are not normally distributed. So rule of thumb is that the Standard deviation should be around about 1/3 of the mean. So 1/3 of 52 is about 18, 17, something like that. Okay. So somewhere around 20, it should be. So that is reasonably well distributed. When do you get normal distribution? I told you some time back. Large sample size, randomly taken sample. Okay, friends. So these are some basics which I thought I'll sort out. And then here is a summary now. Here is a summary when to use what. Okay, maybe at the end of it, you can take a screenshot. Type of data, nominal data, measure of central tendency is mode, and we don't worry about dispersion there. Ordinal data, median or mode, but for dispersion, we take range or interquartile range. Interval data, measures of central tendency are mean, median, and mode. Most important, you will take a standard deviation. You could take range and you could also take interquartile range. And for ratio, again, we usually take mean and standard deviation, right? These are the common. So I deliberately did not explain all of this to you. You will get it in any standard textbook, and you can, you need to take a little bit of time, and I'd urge you to do that within the next few days as we are doing our module on statistics. All right. Few key concepts, p-values and confidence intervals. So I hope you get some good confidence at the end of this in understanding these basic concepts. Okay. A common misconception we have is smaller the p-value, better is the drug, isn't it? Smaller the p-value, better is the drug, isn't it? Or better is the treatment that we see. Okay, it's a misconception, and let's look at it. P-value, what is P stands for probability. And a lot of biology is probability. Did I tell you difference between biology and physics when we started? Did I tell this group? Did I tell you a story from my 8th standard where my teacher gave me a nice twist in my ear? Yes, no? Let me ask Satya. He'll remember. He attended all my sessions.
No,
No?
sir.
You remember? Did I tell you difference?
I don't know if it was in this session or not. I remember the story, yes.
You remember the story. Okay, so let me tell you. So this is 8th standard. Afternoon class, we just finished geometry first lesson, and then first session after lunch. St. Joseph's school. Every time I pass by that school, I still get goosebumps. It's one of the best days of my life. But anyway, so geometry class was over, and the next class was biology. So our teacher came and drew the cell. This is the cell membrane, one circle, and then one circle in the middle. This is the nucleus, whatever. He drew all that colors, this, that, shading, all beautiful. He draws very well. Okay, now students, all of you draw this in your book now. I said, okay. And then beginning to draw. And then after some time, I felt somebody holding my ear and twisting. Those days we got no wax and twist and beatings and all that. It was paining so much. I had to, sorry, sir, what happened? You know what he told me? I'll never forget. At that time, it didn't make sense to me. He said, never use geometry instruments in my class. Never use geometry instruments in my class. I thought, what is this? I wanted to draw a nice circle, no? Nice outside, one circle, then make the compass a little bit smaller and draw a smaller circle. And then I could draw the mitochondria, whatever, all that around it. I thought I'm doing a great drawing. He said, never use geometry instruments in my class. So all of you are surgeons, you know your anatomy well. In biology itself, forget about human body, in biology, is there a straight line anywhere? Is there a perfect circle anywhere? Is there a right angle anywhere? Right? We say long bone, right? Is the femur really straight? Okay. Did you find, is the eye a perfect sphere as well? Is the eye a perfect sphere as well? Anything straight? So biology, there's nothing straight about biology. There's nothing exacting. So biology is not an exacting science. So that is why it makes it that much more difficult for us to make conclusions from biology. Right? So that's why we need larger sample sizes. We need some fairly sophisticated statistical tests, etc. So what is p-value? Probability that the observed result is by chance. And we want to keep that probability as low as possible. We want it to be real. We want that to be real. And it must be interpreted in the context of the alpha or type 1 error And this is decided before study start. When I do sample size estimation for you, I will tell you about type 1 error and type 2 errors. I'm sure many of you have attended statistics sessions where the first thing that they all love to teach is put those 4 boxes: type 1, type 2 error, false positive, false negative, go on and on. And that person is so clear, will go on, and we are scratching our head. Wait, hold on, what is going on? By then, it's gone to the next session or the next slide has come, isn't it? So anyway, I will explain this more to you when we do sample size. Now, what is the meaning of a small p-value? Smaller the value, less likely the finding is due to chance. Okay, so less likely. It's likely to be real. It's likely to be real. Where do we use it? We use it to reject or accept the hypothesis. And when we write the hypothesis, and we do it at study start, not after the data are collected. Okay, misconception about p-value. So I told you already as we started, smaller the p-value, the treatment is more effective. Not really. Okay, the efficacy of treatment is decided by the magnitude, not by the size of the p-value. Okay, and yeah, as I told you, should not be assessed by the p-value. Okay, so the magnitude of the treatment effect is either difference in means or difference in proportions between the groups. Okay, that's what we find. So p-value does not indicate the magnitude or direction of the difference. Is this drug reducing blood pressure or increasing blood pressure? P-value will not tell you. P-value will tell you that it is changing things. And this change that you're finding between groups, this is inferential statistics. The change between groups, is it due to chance or is it real? Next is confidence interval. Confidence interval is the range of possible values for a variable that if the study was repeated on multiple samples from the same population, you'd get it. Now, this is the textbook definition. What does this mean? I will go back. Wait, hold on. Okay. So confidence intervals are 2 numbers. And I think I told this to you when we did the case control design. I showed you how we calculate the confidence interval. What does it mean? We get a point estimate. It could be an odds ratio, a relative risk, a hazard ratio, whatever. Or for the matter, even prevalence of a. So you get a point estimate. What is the chances? Okay, or in that sample that we did, what do these 2 numbers mean next to the point estimate? Those 2 numbers, what does it mean? It simply means if we did the same experiment 100 times, the point estimate that we get will lie 95 times out of 100 within those 2 numbers. 95 times out of 100, it will lie within those 2 numbers. That is what a confidence interval means. So what do we want the confidence interval to be like? It should be as narrow as possible. Now, if you ask me, what is a narrow confidence interval? What is a wide confidence interval? It depends on your sample, and it comes with experience for you to interpret it. And when I show you some more data later on, I'll tell you, okay, this is a narrow confidence interval. This is a wide confidence interval. Okay, this is the test. I mean, this is the textbook definition of confidence interval. What does it measure? It measures the precision of the study result, how precise it has been. If you have a very wide confidence interval, it has been all over the place. Okay. Okay, when we want to extrapolate them to the population. Okay. All right. So I'll skip this part and I'll tell you that the confidence interval gives you both the direction and strength of the probable effect. So therefore, journal editors love confidence intervals. In fact, they don't even bother about p-values now. Okay, p-value can, doesn't tell you so much. The confidence intervals they will ask. So sometimes people have argued back and said, given p-value, how to calculate confidence interval? I don't know. I've given you p-value, it is statistically significant. Why are they asking for confidence intervals? So all high quality journals now will definitely mention the confidence interval. They may or may not mention the p-value. That is why I'm spending time with y'all to explain the importance of confidence intervals. Okay, so let's do a trial of blood pressure lowering medications. Okay, the mean difference is 4.65. That means there is a mean reduction of 4.65 from baseline. Okay, the 95% confidence interval, right, is minus 1.35 and minus 7.323. What does this mean? If I do this experiment again, this trial of blood pressure lowering, this 4.65, 95% of the time will lie between here, between this. So the next time I do it, I may not get 4.65. I might get 4.64. I may get let's go back. I may get 1.36. I may get 7.22. You got it? I can get 6.0. It will lie between 1.35 and 7.23. All right. Now let's look at another confidence interval. What about minus 2.44 and 3.67? Can you get a confidence interval like this? So minus 2.44, it has come all the way to 0, plus 1, plus 2, plus 3 to 3.67. What does this one mean? Satya, you want to try?
Sir, the BP medication is increasing the BP.
Oh my God. Something wrong with this. Very good. Right? So there's something wrong here. In a group of population, this medicine, I mean, something's wrong. I am not going to rely on this. You got it? Right? It's increasing the blood pressure. Okay, so this is not statistically significant, and I will not trust this, and I will not use that blood pressure medication. How about, oh, you know what? Sorry, I made a mistake here. This should have been minus 3.67. Okay, so sorry, Satya's answer is for this. Okay, I made a mistake here. I should change my slide. What is the difference between this and this? Both are minus. Which one is more precise? The second one, isn't it? Second one is more precise. I would like that. And that is also narrow. This is 1.35 to 7. It's quite wide. 1.35 to 7 is quite wide, but it's still statistically significant. But I would love something like this. Right? So therefore, this one is that much more precise. So this is Satya's answer. That is, in a good proportion of the patient, this blood pressure medication is increasing the blood pressure, not decreasing. Okay. Okay, and it includes 0. The moment it includes 0, it is not statistically significant. Or here it is 0 because it's a risk or it's a difference. If it is a ratio, it will include 1. Ratio means 1. All right. So there is a possibility that the treatment has no effect, and I don't trust this. Okay. The treatment, as Satya said, increases the blood pressure. All right. Now let's summarize with p-values and confidence interval. P-value is the quantifiable probability of the finding being due to chance, right? And it gives you strength of that evidence. And it's not a direct measure of the magnitude or direction of the effect. So there's a big limitation with p-value. I want to know the magnitude. I want to know which direction it's going. It's not just how strong the evidence is. You say it is strong evidence. P equals 0.001. But where is it going? I don't know. Now do you realize how incomplete p-value is? You get it, no? P-value information is very incomplete. Now, therefore, let's look at confidence interval. Confidence interval provides a range of values where the truth lies. It provides direction. It provides magnitude of the difference between the two groups, and it also gives you statistical significance. Here also you get statistical significance, but here you are clear about statistical significance as well. So in summary, confidence interval provides more information for you, and always look for that. Hopefully today's key take-home message for all of you is it's what confidence interval is and the importance. Now, do you want to say which is more important? I would say they are complementary. You need to know magnitude, you need to know direction, statistical significance, and also the strength of that evidence. All right. And better to report both in our papers. Okay. Okay, so I think this is a bit of a repetition. I'll pause here for some time, and I'll be happy to take any questions. And I'm also looking at the time. We have crossed 75 minutes, and I will shortly, as last time, I'll show you what we have what Oh, you know what? I'm going to do a little summary as well. You know what? Just hold on a second. I'll finish one more slide, or one or two more slides, and then we can have a little discussion. Okay. All right. So just to give you a few more points about the confidence interval, it quantifies the level of confidence in the interval. If you're using the same words in our estimate. So if it's really narrow, and then we know it is more precise, we got the magnitude, and we also have the direction, right? 95% means we are 95% certain that the true value lies within that interval. That's why we want it narrow, we want it precise. 99% means I'm almost 100% certain that the true value lies within that interval, right? Remember, what we have found is the sample value. We're looking at the population value. So in that population, when I do this project again, the research again, 99 times it will fall within that, which is wonderful. Okay, we usually take 95% confidence interval. Very rarely we take 99% confidence interval. We'll rarely come across. If you regularly read journal articles once in a year or twice a year, you may see a 99% confidence interval. Sometimes guidelines committees will ask for estimates with a 99% confidence interval. So just the Z score has to be changed in that formula, and then you'll get a 99% confidence interval. Sorry, I did not do Z scores for you all. We'll do that another time. Okay, confidence levels must be designated before analyzing the data, right? Or while writing the protocol itself. Let's now summarize with the difference between parametric and non-parametric tests, and we'll close for today. Now, what is parametric data and what is non-parametric? We look at distribution, we look at variance, the type of data, and the measure of central tendency. At least these we'll focus on, right? And what test for correlation for two groups, more than two groups, independent measures, repeated measures, two groups, and more than two groups, right? This is all for our inferential tests, which we'll do from next time onwards. So for parametric data, repeatedly, I told you we need normal distribution, right? Ratio or interval data, and mean is what we use. For non-parametric, any distribution we can do, ordinal or nominal data typically we use, and we use median. Okay. Always an important message, always use parametric tests where possible. Sometimes non-normally distributed data are transformed for us to or to enable us to do parametric tests. Okay. On the other hand, non-parametric data are kind of simple. Okay, and we can kind of manage that, and I'll show that to you when we do chi-square tests and Fisher's exact and all of that. Okay, so here is a quick summary of the different tests that we'll be looking at. So for correlation, we do Pearson's. Independent groups, independent measures, two groups, we do the independent measures t-test, or simply called the t-test. The full name is independent measure t-test. Independent groups, independent measures, more than two groups. There are three or more groups, then we do ANOVA. The full name ANOVA is analysis of variance. The full name, therefore, is one-way independent measures analysis of variance. So that is ANOVA. Now, when we have repeated measures or before and after, same group, before and after, it is the matched pair t-test, or it's also called the paired t-test. The full technical name is the matched pair t-test. Now, we have repeated measure more than two conditions. More than two conditions is not one-way ANOVA, it is independent measures. So it is a one-way repeated measures ANOVA. And I'll also tell you later on about MANOVA and ANCOVA and R-MANOVA. Those are all variants to this. But for now, one-way repeated measures ANOVA. Right. So for non-parametric, what are the equivalents? Instead of Pearson's, we use the Spearman's. And I'm sure you'll have seen these tests. These are all very common fellows who keep appearing in your journal articles. Okay. So Mr. Spearman comes, Mr. Mann-Whitney. The full name is Mann-Whitney U test. Then we have the Kruskal-Wallis test, which is the non-parametric equivalent of the ANOVA. Then we have the Wilcoxon's signed rank test, or just called the Wilcoxon's test. Then we have the Friedman's test, which is the equivalent of the repeated measures ANOVA. So this is a summary. All of these tests we're going to be doing in the next few weeks. I'll give you simple examples. I'll give you, I may or may not show you the formula even, but I'll give you simple examples. Most importantly, how to interpret them. All right. So I will stop here. Maybe I'll just tell you quickly what we're going to do next time. We're going to do the t tests and the ANOVA test. Okay, so that's what we'll do for next time. But I'll stop here now. Happy to take questions or comments. Yeah.
So I just wanted to ask, how would standard error determine the population, like the tendency within the population? How does that work from the sample to the? Like, I didn't
Okay.
understand that table.
Yeah. It's a little tricky. It took me also a little while to understand standard error. Okay, so standard deviation is in one sample, Tanmay. Okay. However, if you go to the population, okay, and you take multiple samples, the variations between those samples is the standard error. So therefore, you use standard error when you need to extrapolate the findings in your sample to the population. Okay, and therefore, standard error is used in your sample size estimations. Okay, so it's for the population. It took me a while to understand that as well. Okay, good question. Yeah. Maybe I can ask you back now. Maybe Tanmay and Satya, you all are the most active participants. What kind of tests do you commonly come across in your articles, and what did you use for your thesis?
So hands down, chi-square test forms the biggest majority to everything, because I don't know, it's the simplest one to do. Then yes, some amount of ANOVA when there have been multiple parameters. When I've dealt with the continuous variables, it is usually the unpaired t-test. I've never done a repetitive measurement, so these are the most commonly one. Thesis for me again was chi-square test. It was I was determining a CRP value for multiple patients. I did not do my thesis in urology. Sadly, I didn't have any. For MS general surgery, I had done. So in that, I had encountered CRP in lap cholecystectomy. So we did a ROC curve and then did a chi-square to determine this thing.
CRP is a continuous measure,
Yeah.
right? You're likely to have done a t-test, not a chi-square.
So it was a less than and greater than. We made it into categorical language.
Okay. Good. Now that you passed your MS, I'll tell
Yeah.
you, never do that.
So thank you for that.
Okay, never do that. I'm glad you said this. See, there are two ways to learn something. No, this is the right way to do it. This is the right things. Please do it. Another way to learn is this is wrong. Never do it. Right. So, and this is a habit we learned in school. Remember, we had some data, and then we had to do 1, 2, 1, 2, 1, 2, 3, 4, 5, isn't it? We did that. What was continuous, we made it category. Disaster. You lose a lot of power in doing that. So therefore, we have to unlearn this. See, you did that, your examiner saw it, passed, everything, everybody's happy. Okay, and that was folks were all blissfully ignorant, and which is fine. In fact, when I was doing my statistics, there was a lot of unlearning I had to do. It was very difficult. I had to hit my head and say, oh, yeah, damn, remove that. Never do that. So once again, let me repeat that. What is continuous? Never categorize it. Today, I mean, why? Today, a bunch of my UG students, they had come. They have age. Okay, 302 patients. This afternoon, 3 o'clock, 3:30, they had come, sir, all the data and all whatever. It's very interesting. Her twin brother is an engineer, and he learned statistics. He knows programming. He did some programming, and then what was continuous? 302. They categorized into 4 parts. Okay, for age, less than 18, 18 to 21. So never do that. Never. It feels easy for us to understand. We lose a lot of power. I'll give an example. Okay, let us say you're taking age. Okay, 18 to 24 is one age group. Sometimes we do that. 25 to 32, another age group. Now, what is the difference between 18 to 24 comes into one group? Okay, right? Now, if you're 24, it comes into group 1. If you're 25, it comes to group 2. The difference there is only 1, but it skips a whole group. 18 to 24 is 6. You remain in one group. You saw the flaw there? Simple things. Simple common sense flaw. Okay. And it's a habit we learned in school. It's a habit we learned, and nobody told us it is incorrect. See, the thing is, if you ask statisticians, they say, no, you lose power with that, never change it. They won't explain to you. Don't change it. No, I'm not comfortable doing categoric tests for that. We'll do, we'll do something else. Okay. So that's the thing. So anyway, good. That was hopefully some good unlearning. And I unlearned a lot as well this way. Okay, good. So, Dr. Apul, over to you for your comments, and then Dr. Arun Chawla and others, please.
I think we learned a lot. And as always, you started with the basics, which was very, very reassuring actually for most of us. So I think many concepts were clear today. And I think these were the things that come very often in all the articles when we are reading. And as you mentioned, maybe how to interpret. See, using statistics is one thing. Maybe we are not doing research, but definitely we are reading other researches. So it's very important that at least we understand what these statistics mean. So I hope that tomorrow it will be more learning, and thank you so much.
Thank you, Dr. Apul. If you'll have 1 minute, I will give you a preview to tomorrow, so you will kind of know what we are getting into. So I'll put it on maybe. Hold on a second. I'll actually put it on. Okay. So hopefully this is large enough. So this is where we concluded with parametric. So we're going to do parametric tests. Okay. So we're going to take 15 patients in one group with an old drug, 15 patients in another group with a new drug, and look at blood pressure change. Okay. And then we're going to do t-tests, and then we'll see who is Mr. William Gossett. He worked in a brewery actually. He came up with the t-test more than 100 years ago. And then we look at this is the key part. You all can see my pointer, right? Is my pointer
Yes.
visible? Okay. So the trick with the t-test is, so you have, this is one distribution, the green one, and then you have a blue distribution. So we have this part which is distinct, we have this part which is distinct. But look at this part. It is there in both the groups. New drug also reduced by so much, old drug also reduced by so much. So the whole thing about the t-test is understanding the difference between signal and noise. So here, difference between the means of the signal, the variability between this in between is the noise. And then I'll show you the simple. This formula looks difficult, whatever. No, when I show it to you later on, it will be simple, and then we'll see what is the signal, what is the noise, and how to discern the difference between signal and noise. And then we look at how we get an output in SPSS, right? Group 1, group 2, 15, 15. What is mean and standard deviation? And then we look for t-test. And what is the meaning of degrees of freedom? And then I'll show you some example from one of the papers I did. And then we will do a before after question, right? And then that's called the pair t-test, how to analyze the pair t-test. Some of them I've hidden. And then let's look at a paper from urology, radical prostatectomy. And then we'll do 3 groups, pain scores with gabapentin, duloxetine, and pregabalin. And that's where we do ANOVA. And why not to do t-test repeatedly? So we'll do ANOVA. We will meet Mr. Fisher, Ronald Fisher. What is the F-test and how to interpret the F-test from SPSS output? And then what are post hoc tests that we do? Different types of ANOVA, one-way, repeat measure, MANOVA, factorial, etc., etc. We look at all of that. So this is trailer for tomorrow. All right. Dr. Arun Chawla, any thoughts from you?
Yeah, I think, sir, one thing I'll say, if you see the last year and this year, we are attending the same subject, but for us who are basically in this stream, takes time to follow. And what in institution for us is the support available by the respective departments of biostatics, where we don't go too much into depth. There's a faculty of statistics is attached to you, and you for everything you go and take the help. But when we get an article for review, say you have to review the article, then you have to look at each and every aspect. It's not that qualitative discussion or something. Then you have to material method to statistics, what tools you applied. It's very important for us to give our comments. For that's how we are growing by attending your lecture. That part which we ignored for many years, probably we are learning and becoming better by better with each class.
Right. Thank you, Dr. Arun. Yeah, it's very nice of all of you, several senior people, very intently listening, interacting, and being so active. Good. Maybe Dr. Ginnell just reached home, ready for dinner. Ah, there you are. Okay, Dr. Ginnell. You're on mute still. We can't hear you.
No, I couldn't take notes today, but I could hear.
Right.
Actually,
Okay.
thing is, repeatedly, we have to hear from you. Then only we'll understand the things.
I'll be very honest and I'll tell you when I really understood it is when I began to teach. So when I was at McMaster, all those big books, and then you make so many notes, all those nice big folders, all of that I couriered it from there, and then brought them back, and I thought I knew. But then once and I took 1 full year after I came back when I began to teach. I came back in 2007. After 2008, 1 year I did not. I was still putting all my slides together, and then again, the more and more we read, the more and more we teach. There is more clarity that way here, right? Okay, so maybe we'll close at exactly at 8 o'clock. And any final thoughts, Dr. Apol, for
Yeah,
tomorrow?
so regarding the
Oh, yeah.
offline session, we are planning it on 28, 29. Just I want to confirm with ASU counselor and just confirm the date, and I will be through. So I think that you are here on 27th, isn't for
Yeah,
your
27.
Tiruvalla program. So yeah, 28,
27th
29
night
we
I
can
can.
plan.
Yeah.
Yeah.
So
So
27th
28,
night I
29
will
is the
be,
plan.
right.
Okay.
27th night I will reach for
So
sure.
yeah. Okay. So that'll be perfect. Yeah.
Okay. Good night, everyone. Good night,
Thank
Dr.
you. Thank you,
Chandramohan.
Janil. Thank you,
Good night.
Dennis. Thank you, Apul. Thank you very much. Thank you,
Thank you, Apul
Chandramohan.
sir.
Good night.
Thank you. Good
Thank you,
night, sir.
Prasad. Good
Thank you,
night.
sir.
Hey, Chandraman. Bye.